Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care, the medical field, and healthcare in general. Here is your host, Dr. Hassaballa. All right, very happy to have you with me. So, starting a new series on Healthcare Musings called Journal Club. And what we're going to do is to discuss various published articles in the medical literature and their implications and their impact on the practice of critical care or healthcare or medicine in general. And so I found this article. It was published in JAMA Network Open, the Journal of the American Medical Association, their open access journal. It was published on April 11th. And the article is entitled "Physician Empathy and Chronic Pain Outcomes." It's out of the University of Texas, of University of North Texas Health Science Center. And it was very interesting, and I wanted to kind of discuss it because I think it has significance for every type of clinician, including those in the critical care unit like myself. So it was a study where they followed patients over time. So there were over 1,470 patients. So there was 1,470 patients, and they were followed longitudinally over time, over several years. And what they did was they measured a level of physician empathy, and they grouped them by those physicians who were rated as very empathic, and then those physicians who were rated as slightly empathic. And then they followed their outcomes with respect to chronic low back pain. Now, for those of you who don't know, chronic low back pain can be a very difficult condition to treat. There are a number of pharmacologic, non-pharmacologic, and even surgical treatments for chronic low back pain, and it can be very difficult. And a lot of people have a lot of disability and pain and dysfunction because of this condition. So what they wanted to see was, does physician empathy, as rated by an objective measure, not a subjective measure, or even self-report by physicians, because I can say, well, I'm a pretty empathic physician, but am I really? I mean, how do you objectively assess that? And so what this article did was they objectively assessed, gave their patients a survey called the CARE measure, C-A-R-E. And C-A-R-E, it was published in 2004, and it stands for the Consultation and Relational Empathy Measure, C-A-R-E. It is 10 questions, and the patient rates the doctor from poor to excellent, and they also have a does not apply. And every answer has a point scale, and the lowest score is 10, minimum of 10, and the maximum score is 50. And so, the higher the score, the more empathic the physician was rated. And so here are the questions. There are 10 questions, and here are the questions. So one is making you feel at ease. Are they friendly and warm towards you, treating you with respect? Does the physician let you tell your story? Does the physician really listen? Is the physician interested in you as a whole person? Does the physician fully understand your concerns? Does the physician show care and compassion? Is the physician positive? Does the physician explain things clearly? Does the physician help you take control? And does the physician make a plan of action with you? And the physician is rated by the patient from poor to excellent. And then they're assigned a score. And so what they did was they broke up into those physicians who had a score of 30 or higher, which was good, very good, or excellent on most items. And those were classified as very empathic physicians. And those with scores of 29 or lower, rated as poor or fair on most items, were classified as slightly empathic physicians. Okay? And they wanted to see what were their outcomes. How did they do? and they did a whole bunch of statistics. And just to kind of give you a sense of the patient population, it was a cohort study, which again, it's a group of patients that they study over time, right? Between April 2016 and July 25th of 2023, which was a long time, and it was in the U.S. And these were patients. Um, they were eligible if they were between the ages of 21 and 79 and had chronic low back pain for greater than or equal to 3 months. Um, and so mainly the patient population was mainly female. Um, about over 70% were a female, and their mean age was 53, so middle age, uh, slightly older than me. And so they wanted to see what are the longitudinal outcomes uh, uh, for those who had rated as very empathic versus those who were slightly empathic. And they found that their pain intensity was lower in those patients cared for by someone rated as very empathic. Their function over time was better, right? Their anxiety over time was lower. Their depression over time was lower. Fatigue over time was lower. Sleep disturbance over time was lower. And then, does pain interfere with your life? In the group that had very empathic physicians, that was lower. And I think all of these measures reached statistical significance. What that means is that it's very unlikely to be due to chance. So this is quite remarkable, actually. This is quite remarkable of a study. Again, chronic low back pain is a very difficult condition to treat, like I mentioned before. A lot of times, pain medication doesn't work. A lot of times, um, procedures don't work, surgery doesn't work. It causes anxiety, causes depression. Imagine being in pain all the time, right? Uh, Less quality of life. But they found that if the physician was rated as empathic, that they did better, um, independently of all the other kind of interventions that they received. That just having an empathic physician makes all the difference. And I think this is such an important thing to take home, that we should. And there was debate when you read the discussion of the article. There's debate. Is there can you teach this, or is this an inherent skill? Is this and I'm of the feeling that you can teach this. That go and the link to the article and the link to the care measure will be in the show notes. So I think you can learn to make your patient feel at ease. You can let your patient tell their story. You can really listen, and there's a whole bunch of exercises on how to be an active listener. You can work on being interested in the patient as a whole person, to fully understand their concerns, being positive, helping the patient take control, explaining things clearly. Right, that's something that a lot of physicians don't do. And I think we can learn how to do these things. I think this is a skill that can be taught and practiced and honed over time. And not only in chronic low back pain, of course, technically from an evidence-based perspective, can you extrapolate this to other patient populations? Technically, no. At the same time, I think when a patient comes in who's critically ill, being empathic, I venture to guess, will definitely help them feel better. Maybe we should do this kind of a study and compare outcomes in the ICU and give patients scales. Was the patient? A lot of times critically ill patients can't answer this measure, but their families can, and they can rate physicians as empathic or not empathic and measure their outcomes over time. See if this can be extended to other patient populations other than just chronic low back pain, right? But I think if the physician makes you feel at ease, you're gonna feel better. You know, um, you're gonna feel better. There's no question about that. So, uh, I you know this is something important that we should take to heart. That we really should work on being empathic with our patients so that they can feel better. And and even if it doesn't affect outcomes for septic shock or whatever, but if you make your patient feel better, if you make your family feel better, that cannot be other than a good thing. So this is a great study, and hopefully, I'm going to try to to be better at being empathic with my patients, and hopefully clinicians and physicians and APPs and other healthcare professionals can take this to heart. Thank you so much for your time and attention. This is Dr. Hashem Hassaballa signing off on Healthcare Musings.